Telehealth waivers for Medicare patients date back to the pandemic and allow for those patients to receive medical care in their homes, but the waivers expired as of October 1st, with Congress allowing the waivers to lapse due to the government shutdown. What is the impact of losing telehealth services for those on Medicare? We asked former State Health Director Will Humble, Executive Director of the Arizona Public Health Association. Will, good to see you. Thanks for joining us here.
Thanks, Ted.
All right. Is telehealth now no longer being paid by Medicare for everyone on Medicare or for just some on Medicare? How's this working?
So it depends on where you live and what kind of Medicare you have. So if you've got regular Medicare, and you're in Phoenix or Tucson, that's an urban area, basically it's almost impossible to get a telehealth appointment with your doctor for chronic medical conditions, primary care visits, follow-up for things like diabetes, stuff like that, because it's no longer authorized. That's not something that they can bill for and get paid for. There's a little more flexibility in the rural parts of the state. There's a few more opportunities to continue to get telehealth on traditional Medicare, especially on the mental health side. But most of it can't be done in the home anymore. And that's the real key feature with telehealth, is that there's a lot of people who can't drive anymore and need to still see their doctor. And telehealth gave them an opportunity to really go see, to have an interaction with their doctor, get a prescription, get an assessment, get some guidance from their doc without having to drive in. And that driving part of it is really a key feature of why Medicare and telehealth was so important, and why people, and not just people, providers, doctors liked it too.
Yes, but again, no appointments now. If you had an appointment prior to October 1st, though, you're okay.
Probably, but I don't know. I don't really know.
Yeah.
Because the reimbursement ended on October 1st for those kinds of visits.
So it's the reimbursement, I got you.
If you're not getting paid for something, then you're not going to do it.
So we're talking wellness visits, like audio-only visits, these sort of, it's ball game, it's over?
Yeah. Pretty much, yeah. Now, not for mental health. So certain kinds of mental health services can still be provided, but not necessarily from your home, So my take-home message for all the people listening out there: don't get mad at your doctor or the person who answers the phone at your doctor's office because you can't make a telehealth appointment. That's not their fault. It's because it's no longer authorized under Medicare.
Okay, but are some providers, are some hospitals still going ahead anyway with the hope of getting reimbursed?
Could be. I mean, some of them could continue to be doing that. Also, there are some people who have not just traditional Medicare, but Medicare Advantage plans, and some of those are more flexible about telehealth appointments.
But again, there's no guarantee of even the reimbursements.
That's correct.
Yeah. And this is a big deal.
Oh, it's a huge deal for especially seniors, people who have difficulty getting around, people who maybe don't have a driver's license anymore, or know that they're a hazard on the road and they shouldn't be driving. And they've now made this telehealth relationship with their doctor for their diabetes, for their arthritis, for their whatever the chronic medical condition is. And now they're losing that. Now, before the pandemic, there wasn't much telehealth.
Right.
But it came in force, and people really liked it, both providers and patients.
You mentioned some conditions there. Are there illnesses, are there conditions that are more affected, than others?
So I'm glad you brought that up, because there's a bill in Congress called the Connect Act. It's bipartisan, and the goal of the Connect Act is to do two different things. A, reauthorize telehealth, but also answer that question you just asked. What kinds of conditions have a positive return on investment for telehealth, so that makes it more effective and cheaper? And so we already know things like diabetes care, some kinds of primary care visits, a whole host of chronic medical conditions are really, and this is a really effective way to help provide that kind of care and treatment for people. But the Connect Act would dive into the details of that and get more refined. And the other thing the Connect Act would do, if we could get it passed, but it's such gridlock, it's not happening, is it would set up an auditing system so that you could have an entire Medicare system to say, hey, looking for that fraud piece.
Yes.
And that's why telehealth was really so far behind the curve is because everyone was so afraid of this is going to be so much fraud. Medicaid access was really afraid of telehealth too before the pandemic. And so the Connect Act would do that loop. A, look at the kinds of things it's good for, but B, set up an auditing system to prevent the kinds of, anytime you have a government program, there's people who want to game it. And you have to have systems in place to prevent that from happening.
That being said, the Connect Act, is there bipartisan support for this?
Yes, there's bipartisan support for it.
Okay, if there is bipartisan support for this, could this be an entryway to getting some of these telehealth situations, especially with folks on Medicare, to getting this stuff back online? Or is that, you think, caught up in gridlock? Once again, these folks come back.
Yeah, well, it's all gridlock right now. Now the big deal is the budget. House isn't even in session to do anything.
Right.
I think that lawmakers, both in the House and the Senate, they're going to start to hear from their constituents. Seniors are not shy about telling their congresspersons that they're pissed about something. And they're going to start hearing as more and more of these appointments end up being denied. I just want to get the message out to them, like, don't get mad at your doctor. Get mad at your congressperson and your senators who haven't brought this up.
And we're coming up to cold and flu season here, so that puts an accent on the whole thing.
Correct.
All right. Last question here. You mentioned, kind of referred to this earlier, but is telehealth a remnant of the pandemic? Is this something that existed because of the pandemic? You say that everyone loves it and they want to get it back. That being said, it wasn't there all that much before. Are we going to go back to that? Is that the natural state of things?
I think it's too valuable. I think people are going to demand that it come back, especially seniors, which is the Medicare population. And you're right. There was a little bit of telehealth before the pandemic, but it's kind of like work from home. Not that many people work from home, but now it's like super commonplace. Same thing with telehealth. That really showed that it can be cost effective, not much fraud, and patients and doctors like it. And doctors can see more patients too. And patients don't have to do all that driving.
Yeah, it's like the Zoom of healthcare, right? I mean, we know what Zoom was until the pandemic, and now you can't get away from it.
Right. I think it's going to come back. I just don't think that you can pull something like this away from people that was so successful over the long run.
Yeah.
Now, right now we're in gridlock and it's stuck, but I think it's coming back.
And if it unstucks with that, then maybe some other things come down the pike as well. And again, we can look at telehealth and the whole nine, to connect the whole 9 yards.
This is not a partisan issue.
Yes.
Medicare, the telehealth for Medicare isn't like a polarized issue. It's just stuck in this gridlock.
Will Humble, Arizona Public Health Association. Will, always a pleasure. Thank you, sir.
My pleasure.